Hi ladies, my name's Lydia Carr and I was diagnosed with breast cancer, infiltrative ductal carcinoma in July of 2015 and went for a bilateral mastectomy. I never heard of post-mastectomy pain syndrome, and when I awoke from surgery, the pain in my left chest was terrible. It was a 10 pain. And my doctors or surgeons could not tell me what was wrong with me. And I never even heard of post-mastectomy pain syndrome until 90 days after my surgery, when a neurologist diagnosed me with this condition, informed me that it was not curable, and I entered into palliative care. I had to have chemo and radiation because my cancer was aggressive, a grade 3, but for anyone who has been through a mastectomy or a lumpectomy or a mastectomy with reconstruction, and you are dealing with a significant amount of pain in your chest wall or in your chest, under your arms, burning pain, stabbing pain, pulsing pain, every kind of pain you can imagine. Life after a mastectomy, if your nerves are damaged, will never be the same again. I have a brachial plexus injury because my lymph nodes were removed, and they take a stick to get to the lymph nodes and practically rip them out of your body. And these surgeries, breast cancer and mastectomy surgeries, I call them assembly line surgeries, because you're not the only patient on that day having a mastectomy. And the timeline in surgery is very short. They use resident surgeons to supervise them to do the mastectomies. Unfortunately for me, I ended up with 2 resident surgeons with less than 1 year experience, and a rush surgery because their dinner time was getting in the way of my surgery. I was the last patient in. So let's talk about what is post-mastectomy pain syndrome. It happens after you have a mastectomy, a lumpectomy, or any kind of breast surgery. Anyone can have post-mastectomy pain syndrome. It is a nerve damage condition, and it is very painful. Opioids many times will bring the pain down, but never a 0. I was, for 7 years, suffered immensely looking for a doctor who could help me. And at surgeon number 9, I finally found Dr. David Lawrence Brown from the University of Michigan. He's online and he does peripheral nerve surgery and has studied post-mastectomy pain syndrome and the reasons for all the pain. And one of the discoveries was made through this testing process is that the intercostal nerves are damaged when you have a mastectomy. They don't save your nerves. The surgeons tell me that it's impossible to salvage the nerves, so they just basically cut your nerves and they entrap themselves into scar tissue or leading into pain immediately after surgery, and you asking, what happened to me? And no one gives you an answer. Your own surgeon in denial, saying, I don't know how this happened. I don't know how this happened. So the first 90 days, you are in what they call acute pain. It's not permanent. Well, we'll see what happens in 90 days. We don't know what's wrong with you. Go ahead and suck it up, is what my surgeon told me. Stop acting like a baby. And I was in palliative care, and the medication that I was on was quite extensive. I was bedbound I couldn't use my left arm. I can't rotate my left arm. I sustained a brachial plexus injury, but that's another matter. Back to David Lawrence Brown, the University of Michigan. I found him on Google on a Sunday, and I searched one more time for post-mastectomy pain syndrome. He's with the University of Michigan in Ann Arbor, Michigan. And I watched his video, which I'll enclose a link. And for women who are suffering terribly with pain after mastectomy, I highly encourage you to please touch base with Dr. David Lawrence Brown. He saved me. Now, a little bit about what I'm going to show you, which may be a little sensitive, but it doesn't show a breast. It shows scars from my mastectomy. And I had a bilateral mastectomy. The left side is the one that was severely damaged, which is the cancer side. My cancer was at 10 o'clock position, and it was growing into the chest muscle. So in 93 minutes, the surgeons that worked on me were finished with a bilateral mastectomy and expanders underneath the pectoral which is a complete nightmare. I had to go through chemo and radiation, and then finally got my expanders out. But I have a hell of a story to tell. But for now, let me show you the scarring of the surgeries I've had in the past years. And the only one that worked and improved my life in a significant way was Dr. David Lawrence Brown. This right here is my chest wall. The scar starts from here and it goes all the way down to here. This is where Dr. Brown went in and took my intercostal nerves that were entrapped into scar tissue deep down, and it was a mess. And they took the intercostal nerves and hosted new tissue, good tissue, and wrapped my nerves up into the new tissue and embedded the intercostal nerves back into the tissue that they got from me, and then closed me up right here, from here to here. The nerves were T3 to T6. Immediately upon awakening from my surgery, my pulsing pain was gone. I had no pain and pulsing pain. I did have some burning pain remnants, and as I healed in the next months, I realized that I also had a significant amount of burning pain. This is my underarm, and what you can see is a scar that leads all the way down to here. And I went back to Dr. Brown for a second time because this felt like bee stings. My pain was so great in my chest wall that I never noticed this pain under my arm until I had this surgery. And all of a sudden, I had the bee stings coming from here. I also had chemo and radiation, if I didn't share that earlier. And radiation is obviously not good for your chest wall, which causes your nerve fibers to just basically get burned. So the first surgery took place in February of 2021, from here to here. And my pulsing pain was immediately gone. And then a year later, maybe less than a year, I called Dr. Brown. I said, maybe I'm going crazy, but I have burning pain underneath my arm. And he invited me back for an assessment. It involved finding a nerve and getting an injection and coming back in 15 minutes to see if I was pain-free. And in both cases, my chest wall and underneath my arm, this area here, the shots that they gave me rendered me pain-free, so I was offered the surgery. My life today is so much better. Am I pain-free? Not completely, but I'm not at pain level 10 either. Now, if you're suffering horrendously with post-mastectomy pain syndrome, please get in touch with Dr. David Lawrence Brown with the University of Michigan. You're the only one that can gauge your pain. Mine is unbearable, was unbearable. It was a 10 level pain I suffered with. And through these surgeries, which are still in its start of its 3-year infancy stages, more and more patients and doctors are learning about post-mastectomy pain syndrome, which affects up to 40% of the women, possibly even more. And I hope that you, when you see this video, will give yourself an opportunity to research Dr. David Lawrence Brown, who's an honest surgeon, and I can't thank him enough for doing what he did for me and giving me my quality of life back. If you are in bed right now and unable to move or exercise in any way or do any lifting, and housework is a total disaster, and you haven't gotten an answer from any of your doctors about this pain, they seem to be clueless about everything. Every doctor I saw couldn't help me until that one magical day I found Dr. David Lawrence Brown on Google and wrote him, and he called me and invited me to come up after a lengthy conversation with him and my story. So I encourage you, breast cancer warriors with post-mastectomy pain syndrome, please advocate for yourself. Fight hard. Call Dr. Brown and let him assess you. I'm an example of his fine work, and I am so much better than I used to be, and I can't thank him enough, and I hope you do the same as well and reach out.